I'd like to take a moment, get up on a soapbox, because I see a lot of patients, at least once a week, that would like to undergo some sort of body contouring surgery, whether it's an abdominoplasty, breast reduction, breast lift, thigh lift, you name it. And many of them come in with a body mass index above 35, that's my cutoff for surgery, and there's a lot of data to support that being the safest cutoff. And the thing that often strikes me is when I do have a conversation with these patients about options to make sure that we do everything that we do in the safest possible circumstances, one part of the discussion revolves around weight loss, getting your weight to a target spot that will be a safer surgical weight and also will improve the outcome substantially. I mean, obviously you want to be as close to your ideal weight as possible. And as somebody who's always struggled with my weight since childhood, and I know how hard it is to maintain your weight and get weight off and everything else, it universally, I hear from these patients that, number one, never comes as a surprise to them that would be better for them from a surgical perspective. But what I frequently hear is that they've had this discussion with their primary care provider, and they're, and asking about a GLP-1 medication, and they're told, well, before we do that, I'd like you to work on diet and exercise, or before we do that, I'd like you to meet with our nutritionist, etc. And I really do feel like these patients, they know what they need to do. And I had a patient recently say that to me. They're like, if I know how to, eat less food, I know how to lose weight. The challenge is actually doing it, implementing it. And it really still strikes me as a very antiquated way of looking at things, where we have these medications that actually remove a big obstacle to weight loss, open the door for better diet, better exercise, better activities, and some positive feedback. And they are actually faced with what I consider to be still a very antiquated notion of carrying extra weight being some kind of a moral or character flaw that is something that they actually have control over, and that there's a failing on their part. And that does two things. Number one, it alienates the patient from their provider, and number two, it just discourages them and helps perpetuate the belief that there's something inherently wrong with them, and that's why they're heavy, and that's why they struggle with weight. And really, it's amazing to me how often this happens, and how often when we tell patients, I say, well, look, we do have a weight loss program here in the office. We can definitely start you on a GLP medication, but if your better option is to go through your insurance and through your primary care doctor, I feel like people should be doing that first. And it really bothers me how often the first option that they actually have is when they're actually seeking out corrective surgery and body contouring surgery, is the first time that they're actually given an option of something other than diet and exercise. And not to say that diet and exercise aren't important, but if something's going to help to kick that off, or something's going to help to facilitate that or enable that, so that the person feels more comfortable going to the gym and starts off on a cycle of improvement because of that. I mean, I can't really understand why patients are being deprived of this. Feel free to share your comments, but I really do feel like, we really need to get away from what I think is a long-standing societal bias that says that somebody who's having trouble losing weight, it must be due to something that's wrong with them, intrinsically and behaviorally, not necessarily a medical challenge. So let me know your thoughts.